such a broad term. So could you help us understand what is encompassed in mental illness?
Sure, yeah, I'll do my best. Mental illness is a no-fault brain disease, and it is involved with disruption in thinking, in reality, in mood, and it's a spectrum, right? So somebody can have serious mental illness, which is, a much less percent of the population, and somebody can be living with depression or anxiety, but about 25% of the population has experienced a mental health condition in their lifetime. So it's 1 in 4 people.
So when we say severity, what do you mean by a more serious and then like a lighter one, just to kind of give us an idea?
Sure. A more serious mental illness we would consider to be maybe schizophrenia or bipolar disorder. Something that is serious, of course, to the person and requires treatment and support, but may not impact their level of functioning the way a more serious one would maybe be an anxiety disorder.
Okay. So let's say I'm a parent, and I know you kind of answer that a little bit, but let's say I'm a parent and I suspect my child has a mental illness. What are some first steps I need to take? What would you suggest that I do?
It's a great question. It's a really good opportunity to utilize your primary care physician or your PCP or your pediatrician. We're not really screening in the medical profession. We're not really thoroughly screening for mental health concerns, and some doctors may do more than others, but it's not standardized. So I would talk to your pediatrician if you feel comfortable and say, I'm concerned about my loved one, I'm concerned about my son or daughter, and hopefully they can give you a referral for a psychiatrist to do an evaluation or a psychologist. You can also call us at NAMI. Our helpline is 312-563-0445, and we're able to help somebody figure that out as well. But I think utilizing your primary care is really helpful.
So that's in a situation where it's like we suspect. Now, what if it's a more severe situation?
Okay.
For example, it might be a situation where my child might have attempted suicide or something like that, and obviously that's a more of a mental health situation or mental illness. What if it's like something that, I guess, immediate? What would be your suggestion in that case?
So I'm going to answer you kind of in 2 parts, okay?
Excellent.
So if somebody is threatening suicide, making threats, or you've seen them that they've written something down that they're saying that they're thinking of harming themselves, that they're thinking of killing themselves, taking their life, we immediately want that individual to be taken to a hospital. And they can go to the local emergency department, or if it's a youth, there's specific hospitals for youth that provide excellent treatment. If somebody has attempted suicide, you want to call 911 immediately and get them to the hospital. The thing that we really need to remember is that this is not attention-seeking behavior. These are people who are in a tremendous amount of pain, and they're communicating their distress through these behaviors and these actions, and we want to take it really seriously. We want to make sure that they know that they're not alone and that their help is available for them. So what somebody could do in that situation, of course, is call 911 and request a ambulance to take them to the emergency room. Sometimes in other crises, Paula, you could utilize a CIT trained officer, which is a crisis intervention.
Which was actually going to be my next question.
Well, look at that. I kind of thought so. Do you want me to talk about it?
Please, go ahead.
So the Chicago Police Department has this incredible program, and it's called Crisis Intervention Team Trained. It's a 40-hour training given to officers, and there's about 1,300 officers in Chicago who've gone through this training. And somebody can call 911 and request a CIT-trained officer when there is a mental health crisis. These officers have a very different training and can de-escalate in a much more appropriate way and bring people to care. Sometimes behaviors may look criminal, but these officers are able to detect that and take people to a hospital instead of, a criminal justice lockup situation.
And that's very important that you bring that up, that you emphasize that I need a make sure I get it, CIT, a crisis intervention
Yeah.
team or officer to come onto the scene. Because otherwise, they may not know and assume that it is criminal, and it can lead to, more severe actions.
Sure.